ABC's Josh Sanders shows us what's being done to combat those numbers. Josh?
Jessica, a new study ranks Kern County as the 52nd least healthy county out of 57 in the state. But the Department of Public Health says they're taking a proactive approach in lowering those numbers.
The study out of the Robert Wood Johnson Foundation and University of Wisconsin Health Institute measures a number of health behaviors contributing to the ranking.
Well, I will say what a report like this does is it does shed light on some of the issues we face here in Kern County.
Three of the biggest issues: sexually transmitted diseases, adult obesity, and adult smoking. According to the study, there are close to 700 newly diagnosed sexually transmitted infections per 1,000 people.
This is unacceptable. We need to do better as a community because we consider it a health crisis when we have some of the highest rates of STDs in the state.
Just under 2 years ago, Public Health launching the Know Your Risk campaign, including a task force, partnerships with local community members, and a website in order to provide information to the public. But officials say the STD campaign isn't a quick fix.
We've said this isn't going to take 6 months or a year or even 2 years. This is going to take a long, sustained effort to really get us out of the trouble that we're in.
Another area where Kern County is struggling is obesity. About a third of the population here is considered obese. Public Health is set to launch a new anti-obesity campaign this summer, focusing on what people can do at home and free health screenings.
It's for the community, free of charge. Give them what their body mass index is, give them their weight, give them their blood glucose levels, just so that they can help make better decisions given the information that they may not currently have available to them.
And when it comes to smokers in Kern County, about 16% of the population use tobacco. To try to stop that number from rising, officials are turning their attention to the youth, putting provisions in place to prevent retailers from selling to minors. The Kern County Department of Public Health says it doesn't know why we're continuing to see these high rates, but they will keep working on lowering the numbers. Officials say to them that means focusing on prevention.
And so that's just, really where we're targeting right now. Let's prevent those that don't have the diseases, and then let's try to help those that do have them with controlling them, with managing them.
Now, public health officials say they're reviewing the findings of this study to see how they can modify their current health programs and make them better. Live in studio, Josh Sanders, 23 ABC.
Josh, thanks. Dozens of